I'd like to talk about natural ways to whiten your teeth. Everybody loves a whiter smile. We notice it. It makes us feel a little bit more confident in ourselves and our smile and the way we're presenting to the world. In fact, my whitening tooth powder is my most popular tooth product. So, if we want to whiten our teeth, do we have to do it professionally? Well, let's talk about that. I'm going to talk about why do teeth even need whitening to begin with, ways to whiten that are non-bleaching options, and then why those bleaching options work and what to be maybe concerned and watch out for. Let's get into this. So the first question is, why do teeth need to be whitened to begin with? Some of it is simply just environmental. It's the food that we eat. So if you eat a lot of really highly pigmented foods, think about things like blueberries or beets or a lot of greens, you might have some stain that actually stays on the teeth. If you are drinking a lot of coffee or darkly colored teas, if you smoke cigarettes, all of these things will also deposit stains on the teeth. If you are not actually cleaning your teeth very frequently or very well, some of those stains will get caught in the plaque and then the tartar on the teeth, and it will also leave staining on the teeth. Sometimes even the bacteria in your mouth will actually be what are called chromogenic or colorful, and we'll see black, brown, yellow, green, orange stain that's actually bacterial buildup on the teeth. These are all reasons that the tooth will look darker, but they actually don't have much to do with the fact that the tooth itself is darker. There are two things that lead to the tooth itself looking darker. One is age, and that has to do with the way the tooth is built. The outside of the tooth is called the enamel, and it is the whiter layer of the tooth. It is full of minerals. The inside layer, the next layer in, is called dentin, and it's a lot yellower. There's a lot more color or pigment in that dentin layer. Well, the thicker the enamel layer is on the outside, the more it blocks out that darker yellow color underneath. So as we age, sometimes based on lifestyle and things, sometimes that enamel layer gets thinner. So there's less of the white layer to block the yellow layer underneath. So the teeth start to look yellower. We're going to get into a little bit about how we can counteract this in a while. The other reason is some sort of systemic issue that's actually depositing color in the teeth. So when you're little or developing, this could be a high fever that can create, sometimes we'll see a fever spot right here in the front tooth or sometimes on the back first molars, and it's because you had really high fever, maybe a strep throat, a sore throat, something like this going on, ear infection when you were about 2 years old. And it actually affected the developing tooth bud, which causes a stain, and it'll cause it on any tooth that was developing at the time. So we'll often see it, like I said, on the front teeth and the back molars. They were all developing around 2 years of age. So that's one intrinsic problem. Another intrinsic problem is medicines. So one famous one is tetracycline. Tetracycline was used for things like ear infections and strep throat and things for a while in children. What they didn't know is that tetracycline actually incorporated into the developing tooth structure. So we will see people that have banded teeth. They are very dark, kind of a grade of yellow all the way to brown, and they're striped. There's stripings of this coloring. That is due to tetracycline. So thankfully, they learned after seeing a generation of children with this in their teeth that never give tetracycline to a child because it's always going to get into the developing teeth. Sometimes we will see it when we're removing wisdom teeth because they give tetracycline sometimes to teenagers who have acne issues. Well, which teeth are developing at teenage years? The wisdom teeth. So we'll take a wisdom tooth out and we'll see that same banding or striping on it. This also happens in adult times. So if you have a new medication that you're taking, some medications will affect the internal pigment of the tooth. And I had a patient that this happened to. She started on a new medication, I believe it was for her heart, and within about 3 weeks' time, her teeth went about 2 shades darker, enough that it was very noticeable. Her family started commenting on it, but she could even see it in pictures. It was a lot. So what do you do about that? We're going to get to that in a minute as well. So those are the reasons the teeth need whitening. Number one is just that they're stained. There's something you need to get off of the surface of the tooth. That's the easier one. The second one is it's something inside the tooth itself. That's harder to deal with. So let's talk about both, and we're going to have solutions for both of these things. There are really 2 categories of tooth whiteners. Number one is non-bleaching items, And the second is bleaching items. So let's tackle the non-bleaching items first. What are those? Those are things like my whitening tooth powder. They are products that literally will clean off the stain on the outside and sometimes even a little deeper into the tooth. So they're stain removers. They're not bleachers. They're not changing the actual physical structure of the tooth or bleaching the tooth. They are just removing the stain or things that are on the outside that discolor the tooth. And they work great. And there's numerous different versions of them. So in my tooth powder, I include hydroxyapatite, which, let's talk about that for a moment. Remember how we said that the enamel layer is full of minerals on the outside, and it's the white layer, the layer that blocks out the yellow underneath. Well, the hydroxyapatite is white. It's the thing that our bones are made of, our teeth are made of, and it's white. The more hydroxyapatite you have in your tooth, the whiter it will appear. So that's the great part about the tooth powder, is that every single one of them contains hydroxyapatite. You don't even have to use the whitening version. You can use the other versions. And they will make your teeth stronger, more dense, less porous, and whiter, because the mineral that's deposited is white and it will block out the yellow underneath. So I had an interesting experience with actually a family member. They struggle a bit with mouth breathing at nighttime. So I've started mouth taping at night to keep those lips closed. That's one of the things that will cause teeth to discolor, is if they're drying out all night long. And it sometimes will pull some of those minerals out. So mouth breathing will lead to teeth that you want to whiten as well. But this person was struggling a bit with mouth breathing, and it was interesting. Whenever they'd go in to get their teeth cleaned, there was this defined line right across here where their lips sat, because the rest was dry. And the lip sat there, and it was darker below that lip line. So they went in to see the hygienist, and the hygienist said, "Whoa, you've been bleaching your teeth." And this was a person that had been resistant to doing any bleaching. "You've been bleaching your teeth." And they said, "No, actually, I've just been using the tooth powder." And my hygienist kind of laughed and said, "Then it works," because your teeth are noticeably whiter. Hadn't been doing anything other than just using the tooth powder. So hydroxyapatite alone will make your teeth look whiter. Isn't that cool? But what about removing the stain? So again, in the tooth powder, I have a few things, and you don't have to use the tooth powder. You can use other versions of this. You're going to be able to find them, but I've just put them all together in this. So baking soda. What does baking soda do? Well, this is the reason we use baking soda as a cleaner. You can use baking soda to clean your countertops or your toilet, because it does clean stain. Now, remember, tooth structure is much harder than stain, so it's not going to scratch your tooth. It's just like you can use that baking soda on your toilet. It's not scratching your toilet, the porcelain surface of your toilet. It's just removing the stain in it. Same with your tooth. It's not scratching or damaging the enamel. It's just removing the stain that's on the top. So baking soda will do that. Salt will do that. Again, salt's a natural cleaner. Salt's also in here. And another one is charcoal. So what does activated charcoal do? And there's some misnomer or kind of some misinformation about activated charcoal. A lot of people say, the charcoal is going to, two things, it will scratch your tooth or it will deposit in the gums. Well, there's a key here. First of all, why would we even use it? Charcoal is absorbent. So this is why if you take something that's poisonous and you swallow it and you call poison control, they're going to say, "Do you have any activated charcoal at home?" You need to swallow that immediately, because it will absorb what you've just eaten and what you've just swallowed. The same thing will happen in a tooth powder. If there's charcoal, it will absorb the stains. It will absorb the stains that you loosen. As you're brushing and you're loosening up stains, it will absorb them. It will hold on to them and allow you just to spit it out, or it'll go out the other end. So that's what the reason why you're using charcoal. But the key is the size. So the size is the key for gums. You have to have very, very small particles that will not actually embed in the gum tissue at all. And the size that we use in the tooth powder doesn't create any issues with that. The second thing is charcoal itself is not abrasive to enamel. This is based on the hardness level of enamel and the hardness level of charcoal. Anything softer than enamel won't scratch it. Enamel is about a 4 to 5 on the scale that we use. Charcoal is a 2. So it's much softer than the enamel. So if people say, do not use charcoal because it's going to scratch your tooth, it's actually not true. It will not scratch your tooth. It can't. It's not hardness. So those are some really easy to use things that you can do at home. You can even use your own hydrogen peroxide. We're going to talk about that in a minute. But you can mix hydrogen peroxide and baking soda. It's going to be at a lower percentage. So it's going to be more of just in this category of stain remover than a bleach at that point. But it does activate that baking soda a bit. All of these things you can use. You can even use things like strawberries. Strawberries are great. Now this is interesting. A little piece of history here. So there is evidence that shows that people, the Egyptians, the Romans, actually were whitening their teeth. centuries ago. And there's record that shows that they were using urine mixed with goat milk. I don't know about you, but I'm really happy that I'm not actually swishing or using urine and goat milk to whiten my teeth. But what did it do? Well, urine is slightly acidic, and when it degrades, it turns into something called ammonia. Ammonia is a natural cleaner. You can also use that on your toilet, ammonia at home. So it actually was probably whitening the teeth and cleaning the teeth and scrubbing them clean. We have different versions now. We don't have to use that. But there are things you can do, even strawberries, even some of the foods you can eat are actually really good natural cleansers. Another is a probiotic or something that will kill bacteria in the mouth. Remember how I talked about their staining that actually have colorful bacteria in them? Well, the mouthwash is amazing at that because it has colloidal silver. So it's going to kill the bacteria, balance the bugs. The other thing that works great for this is oil pulling. Oil pulling actually balances the bugs in your mouth. You're going to use a tablespoon of oil, put it in your mouth, swish it around for 10 to 15 minutes, spit it out in the Kleenex and throw it away. Why are you throwing it away in the Kleenex? Well, you don't want to clog your drain. But second, it's full of bugs now. So you're going to spit that out, throw it away. Use it about every third day is what I recommend. And will you get some whitening from that? You will, simply because you're going to take care of those colorful bacteria. So lots of different ways naturally that you can do this. Hydroxyapatite, baking soda, salt, charcoal, foods like strawberries, and even oil pulling. All natural ways to whiten your teeth. But remember, all of those are going to be doing stain removal. They're the non-bleaching cleansers. So now let's get into the bleaching cleansers. What are they actually doing? It's interesting. The way that dentists now use something called carbamide peroxide, which breaks down into hydrogen peroxide that you've all heard of. So they're peroxide-based formulas. These are the ones that you wear in trays, that you wear as bleach strips. We're going to talk about pros and cons of all of these in just a moment. But what does it do? Well, interestingly enough, hydrogen peroxide is actually good for your gums as well if you have gum disease, gum infection, short term. So years ago, doctors made some specially fitting trays that would go in people's mouths and put hydrogen peroxide in them and have them wear it at night if they had gum disease. Patients were coming back weeks later to see how their gums were doing, and they had noticeable whiter teeth. Both the patients and the doctors were noticing and saying, "What are you doing?" "Well, I'm just wearing these trays at night to help my gums." It was whitening teeth. And that's how they discovered it, that that's actually what it does. Now, hydrogen peroxide goes after the organic parts of the tooth. What is that? So one of the uses for hydrogen peroxide, I just taught my daughter this the other day and she was blown away. She said, "Why do people not know this?" She got some blood. She had a bloody nose. She got some blood on her pants and she was super bummed because these were pants that she loved and she was planning on wearing them somewhere. And I said, "Oh, that's easy. We can take care of it. We'll just get some hydrogen peroxide." And she said, "What do you mean?" I said, "Let me show you." So I got some liquid hydrogen peroxide, put it on a rag, rubbed it on the pants. Blood was gone within about a minute's time. And she was like, "Why do people not know that this takes out blood?" Hydrogen peroxide takes care of the organic things. So it's things like blood. It's things like organic stains that are in the tooth, which are oftentimes from food and sometimes even just stains from the things that we have going on in our bodies. So it's going to take care of anything organic. What it actually does, it attracts electrons. And when you attract electrons and pull them away from molecules, those electrons are kind of like magnets holding everything together. And if you pull those away, all the pieces of the little molecule just kind of fall apart. That's what hydrogen peroxide does. It pulls the electrons away from the molecule, leaving it to just fall apart. And then you're able to brush it away. The stain leaves. So anything organic in the tooth is going to be affected by these bleaching agents, by a peroxide. Why does it affect the enamel? Well, it does a little bit. But enamel is inorganic. It's a mineral. It's not a living thing or was a living thing. It's a mineral. So that mineral isn't affected other than there are still organic things in all the tubes going through our teeth. So there's tubes and then there's a mineral structure and there's space around the mineral structure that organic things get in. So this hydrogen peroxide gets into those spaces and dissolves or breaks apart the molecules that are living in the spaces of these crystals. Why could this be problematic? Well, it's basically making the enamel more porous. So now, a lot of times those organic molecules that are filling up all the space in the enamel, they're the things that keep cold water from getting to the nerve of the tooth, hot water from getting to the nerve of the tooth. So a common complication of doing any of these professional whitening treatments is sensitivity, and a lot of sensitivity, because again, you've opened up all of the pores in the tooth. You've removed all of the organic matter in there with all those peroxides, and you've opened up all the pores so that anything can get in and you are going to feel it in that tooth. Sensitivity is a big thing. So how have these been counteracted? Well, a lot of the bleaching materials now have something called potassium nitrate, which will get in and kind of plug up those holes for you. They have other desensitizers along with the bleaching. There are ways to get around this. So let's talk about the different forms and when you would use them and the pros and cons, because the sensitivity piece is part of that con. So there are strips that you can use. You can get these at the grocery store. They also have hydrogen peroxide, but they don't have the higher amounts like a professional dental sold whitening treatment does. Why? Because it's regulated. They don't allow you to put a high enough concentration in the one at the store. But can it bleach? It can. It's going to be a little slower, but sometimes people will see results within a few days. So they're just strips you put on the outside of the tooth. It's a peroxide. It means it's pulling, those are dissolving those organic stains from the inside of the tooth, leaving the tooth a little more porous. What are you going to want to do? With every one of these treatments, you're going to want to follow it up with a hydroxyapatite tooth product. We want to fill up all of those holes as much as possible so that sensitivity goes away. The next one up is going to be a non-custom made dental office treatment, dental office bleaching treatment. Again, it's controlled, so it'll be a higher percentage than you can buy in a grocery store, but they're not custom. So they're kind of one size fits all. You take out an outer tray, you put them in, and they would fit everybody. Does that work? It does. The problem with it is that bleach doesn't stay put because they don't fit your teeth very well. And the other problem with bleaching, with these professional bleaching products, is that they cause a lot of gum sensitivity. They can really hurt the gums. So if the tray isn't custom, it doesn't fit very tightly, that bleach can get on the gums a lot easier. So they can't go very high with the percentages, again, because it's going to damage gums, and you have to be very careful with it. So that's the next one. The next one up is a custom-made tray. We take molds of your teeth and we make a custom tray that fit very tightly, very intricately to the tooth. So we can use a higher percentage because it's not going to leak out as easily, and you don't need to use it as long. The less custom it is, the more saliva gets in there, kind of mixes in and dilutes up the bleaching materials, and it's not as effective. So the more custom they are, the better effect it's going to have because it's going to hold it against the tooth without getting as much saliva in there. That's the next one up. There are some at-home versions of this, but remember I told you the percentages were controlled. So anything you buy online that says this is going to bleach you just as well as something in dental office, it's actually not, because the percentages are too low. You're not going to get the exact same result. Will you get some result? Probably, but you're not going to get the same result as a professional dental whitening treatment because the percentages just aren't as high. If they're not as high, the effect isn't as prominent. The other issue is there's a lot of these online ones that show a light. Well, I'm going to debunk this for you right now. The light is show. It's because it makes you feel like you're doing something cooler when you have the light. There's a lot of studies showing that the light actually doesn't do anything to speed up the process or to make it bleach even more. So don't waste your money on that. All right, so that's the in-betweener. You can get those online. I wouldn't honestly recommend them. You can try them, but I don't think you're going to get the result that you hoped for with them. So then the last one is an in-office whitening treatment. At that one, we use the highest percentages possible. So give and take here. You're going to whiten fast, but you're going to be probably very, very sensitive because it's going to get deeper into the tooth than in the others. So you're really going to open up all those pores. And man, sometimes people have to go home. They have to be on pain relievers after this because it is so painful. We also use blockers that go along the gums because, again, with that high percentage, you could fry off your gums in a minute's time. So you really have to be careful. Make sure that you're doing this at a dental office that knows what they're doing, and it's applied very, very carefully and cautiously because you can really get burned. Your gums, your lips, your teeth, your tongue, everything could really get burned and very, very sensitive, so be very careful. Here's the other caveat. Typically, the faster you bleach, the faster it rebounds. So when you go slower, my preference for everybody is a custom-made tray from a dental office. It's going to fit tightly to the teeth. It won't dilute as much. You're going to be able to use a higher concentration, but it's not as dangerous, and you're going to bleach slower. You're going to bleach for about 10 days. Typically, we like you to wear at least an hour or two or overnight. You're going to wear it for about 10 days and you're going to notice a noticeable improvement of whitening. Now, if it's just stain you need to get off, use the other things we talked about. But if you really want to get into the tooth and get that darker, deeper layer, then you need to do some sort of professional whitening. Now, this doesn't fit into the natural category, does it? Well, kind of. It's a hydrogen peroxide. But be careful and cautious with the way you use it. That is my preference by far. It's a custom-made tray if you want to do the bleaching agents. So we've talked about a lot today. Everything from why do teeth darken? Why do we even need to whiten? To non-bleaching items that you can do at home that get off stain and keep your teeth white. And that's really what I would recommend to keep. And for maintenance levels, use the whitening tooth powder. Use these other things and maybe be as white as you need. I've actually not bleached my teeth in probably at least a decade. I use the whitening tooth powder every single day. People are always saying, your teeth are so white, they look amazing. That's what it is from, is simply the whitening tooth powder. It works great. And the mouth rinse, I use them both. So lots of hydroxyapatite in these teeth. I also don't get cavities. I don't even think about cavities because my teeth are so strong. So that's the non-bleaching versions that whiten teeth. And then there's the bleaching versions. Need to be administered by a dental office if you really want a big enough effect. Now, what do you do about that sensitivity? No matter what, anything you're going to do, you're going to follow it up with the hydroxyapatite tooth powder. It's going to fill in all of those pores and it's going to close up everything and make it less sensitive again. What I recommend and what people say works the very best is to use the mouthwash and then the sensitive tooth powder. If you really have a lot of sensitivity, mouthwash, sensitive tooth powder, you're going to notice a huge difference. Hopefully this information has been helpful to you, gives you ins and outs of all the whitening options, ways to do it naturally, ways to do it through a dental office, but also debunking some of those myths. Let's not be like the Romans. Let's not use goat milk and urine. No need today. So many different options. And make sure a lot of this is centered on hydroxyapatite tooth powder to rebuild the teeth naturally and make them white naturally.